After my experiences with bacteria and cancer cells grown in tissue culture, DNA, and even changing the structure of water through loving intention, and documenting that, as I went back to my practice with patients, I now had a deeper awareness. I've never left my practice with patients, I should make that clear. I was just doing this research. But when I went back with that background of research, I began to notice that most illness, not all illness, but most illness, and all suffering and distress were related to a sense of separation that people had, of one part of themselves from another that was too painful to hold in consciousness, related to some early wounding. Could have been in childhood, could have been sometimes even as an adolescent, but it always went back to an earlier time in their life. And especially common was a deep wounding when they were in their mother's womb. And whatever their mother was feeling at the time was absorbed by them, because they were feeling no difference, no separation from the mother. So everything that the mother was feeling was absorbed by them as if it was theirs. And of course, what mother was feeling was influenced by the collective consciousness at the time, the relationships that she was having to others in her life, her partner. I began to realize the impact of the belief systems that people had. And we talked before about the placebo effect. Tremendous impact that the placebo effect has in human beings. That's why I did the research with single-celled organisms, so we could avoid that. But now I had to go back, working with people and dealing with these belief systems. By the way, there was also a sense of separation, not only of one part of oneself from another. For example, feeling I'm not okay, I'm not good enough, I'm a mistake, my father wanted a boy and I'm a girl, etc. But there's also this sense of separation from others. When one looks around, one sees that one is different in appearance from others. And there are cultural differences as well, and religious differences as well, racial differences as well, language differences. And so there's a misinterpretation about difference. The misinterpretation is that difference means separation. And that's a profound misperception. So that's what I came to realize as I started to work with patients in my practice. And then I decided that because of these tremendous limitations working with humans, I can develop some processes that perhaps could start to dissolve these veils that separate us from our inner light, from our true nature, from the light of consciousness itself. And so I went on to explore first the veils and then develop processes to dissolve the veils. And again, what I discovered was the key. The veil itself was the identification with our mind-made or psychological self as our thoughts, our feelings, our senses, the identification of the mind-made or psychological self, or sometimes called the ego, with our beliefs, because all beliefs are illusions. But we identify with those beliefs, and with our story of who we are, as if without that story we wouldn't exist. But if we had amnesia and we forgot our name and our story, would we still exist? Who would we be without our thoughts? Would we still exist? What happens at the end of one thought and before another occurs? Do we exist? Of course. So when all of this and our experiences and our memories dissolve, all concepts and notions about who we are dissolve, what would be left? What remains? Consciousness. As emptiness, as stillness, as freedom, as peace, as love, as joy, as simple happiness, the happiness of being, the happiness of